outpacing advances in modern medicine. Its drivers are multifaceted, and its impact on public health and the economy remains profound. This week on Health Digest, Gloria Milimu looks at the economic burden of these resistance in Kenya and why investing in vaccines offers an opportunity for countries like Kenya to tackle this modern public health challenge. Take a look.
Infections are becoming harder to treat as bacteria causing them continue to evolve and proliferate, causing prolonged hospital stays and mortalities globally. While this resistance is gradual, its impact on health is profound. When antibiotics meant to treat these infections become ineffective, their magnitude and public health impact become a challenge that transcends the human health. Economically, they put a strain on health systems, compounding the treatment cost of diseases experts say are vaccine preventable. For instance, in 2019, Kenya, which ranks 28th out of 204 nations in terms of age-standardized mortality rate due to antibiotics resistance, recorded 8,500 deaths directly attributed to AMR. Another 37,300 deaths associated to antibiotics resistance were also recorded during the same year.
Close to 1.3 million deaths were directly attributable to the drug infections globally. So this rising prevalence of drug-resistant infections obviously poses a major challenge to the modern medicine, whereby it limits the life-saving therapeutic options, the options that we have for treatment, especially for those who, for one reason or the other, cannot afford the more expensive antibiotics. We're talking about the second or third generation antibiotics.
These resistance patterns, according to public health specialists, complicate treatment outcomes for patients, especially in vulnerable populations. Child health experts say the leading cause of mortalities among children under the age of 5 includes dehydration and sepsis from diarrheal pathogens and bacterial pneumonia, which are largely preventable through vaccination.
When we've had outbreaks, we've had up to maybe 60 children getting infections with what I said are called gram-negative infections. So a bit technical, but it is a serious infection, usually acquired in hospital, and you can have mortalities of up to 85%.
They reckon that the burden of these vaccine-preventable bacterial infections reinforces the critical role of immunization in preventing resistance. For instance, preventing typhoid fever would only cost 520 shillings in vaccination, according to experts. Yet, treating the disease in the case of a multi-drug resistant strain would cost between 65,000 and 150,000 shillings for a disease that can easily be prevented. For rotavirus, a common childhood illness that causes fever, vomiting, and sometimes abdominal pain, hospitalization with the infection is estimated to cost between 4,000 and 18,000 shillings. Yet, this is also a vaccine-preventable illness that can be kept at bay with at least 390 shillings per dose of vaccine. Other vaccine-preventable infections include meningitis, tuberculosis, pneumonia, and malaria.
All those pathogens or organisms are actually susceptible to resistance, and therefore this is where using vaccines to mitigate antimicrobial resistance is important, because we do not have enough resources to invest. A lot of money is required to invest to develop an antibiotic, for example, but if we use vaccines, we can be able to prevent a number of these infections.
By preventing infections, vaccines reduce the overall use of antimicrobials and consequently the selective pressure that drives resistance. Experts argue that AMR is not just a medical problem, but a looming economic disaster that could destabilize healthcare systems and slow global economic growth. To counter its impact, they recommend the need to invest in preventive measures like vaccination, surveillance, and sensitizing communities on the importance of sanitation.
When you look at the mechanism of action, for vaccines, they're able to stimulate the immune system, and by that way they prevent specific infections well before they occur, which is advantageous. But when you look at antimicrobials, antibiotics on the other hand, what they do as far as how they work is they target and kill or inhibit pathogens directly to treat or prevent infections post-exposure. So they start intervening where the problem has already occurred.
Enforcing regulations on drug use and implementing antimicrobial stewardship.
REBC is allaying fears over the move to register Kenyans who are registered before 2012.